Hello, my name's Tariana. I'm 39 years old and I'm going to focus on living.
My name is Graham. I'm 58 years old. I want to stay as busy as I can for as long as I can.
I'm Ron. I'm 52 years old and I just want to get on with life. After I took ill and spent about a week in hospital, several tests over the course of a week, doctors weren't sure what had happened. I was referred for a CT scan. I got called back in to see the local surgeon who pretty much straight out told me I'd had a cancer in my pancreas. Could have knocked me off my seat at that stage. Never even thought of it, didn't even know it was coming. Being a regional surgeon, he was a general surgeon, so he didn't specialise, so straight away he referred me to a specialist in a larger rural centre. While sitting in the room with him, straight onto a phone conference with the other surgeon who was looking at the results, and he even just said straight out he can't do anything about it and referred me to another specialist down here in Melbourne. From then I was set with an appointment within a couple of days to come down to Melbourne and basically fronted the surgeon down here, and he didn't give me such good news either. He said with the current diagnosis I was looking at 6 months of life, but he said he's going to discuss it with his surgical team. Don't give up hope. They're going to have a look and see if they can do something for me. So with that, end of the consultation, and I've headed back home, a couple of hour drive, and it was a pretty quiet drive back home. So when I arrived back at home, I literally pulled up in the driveway and the surgeon had rang again and said he'd been looking further at my test results, going to discuss a bit more with his team, and he reckons he might be able to do something. So he gave me a glimmer of hope.
Okay, the lead up to it was I was unwell for quite some time, and I was admitted to hospital with pancreatitis. On from that, once I got over that and rested up, I got the same pains back again. So I went to my GP, he took a blood, and away we went from there. And the result of that blood was he seen something he didn't like, sent me for an ultrasound the next day. 2:30 in the afternoon, he rang to see if I could be at the hospital in an hour's time to have a CT scan. And that's when that was confirmed. He waited at his surgery till I got back there about 6:30 that evening, and he delivered the message of what was going on. At that point, I did not know the significance of pancreatic cancer. I had no clue the seriousness of it. In my mind, leaving there, I wanted to kick the cat, so to speak, but I just had it in my mind, I have a tumour, I'm going to have an operation, and it's gone. And that was further from the truth as it unfolded.
So I was diagnosed with pancreatic neuroendocrine tumours in September 2014. I was given the diagnosis after I had a laparotomy done, and the reason for the laparotomy was to get a biopsy of the actual tumours that were in my abdomen at the time. I was very apprehensive up until that time, just not knowing what I was going to be told I had and what it was, just because there were quite a few variables in terms of what the diagnosis might be.
Yeah, Google's a wonderful thing. You get on there and you start searching, but you start looking at that stuff and you start seeing pancreatic cancer and you start seeing the statistics for it, and in the end it's not much good to you. You start getting information you don't want to see.
I took my time. So having been diagnosed in September 2014, being told I had pancreatic neuroendocrine tumours, I was advised that they were slow growing. I had quite a number through my abdomen and the primary and the pancreas. I was told that I required what they call a Whipple surgery, which is quite a big surgery. Which involves the removal of the pancreas, part of the stomach, gallbladder. So that in itself, being told that I need this surgery was quite confronting. Went away and sort of processed that and thought about it. In my case, at the time, I had a 2-year-old and a 5-year-old, so 2 little girls. So it's just sort of going through and sort of thinking through the logistics of, okay, well, I'm going to have this surgery. I'm going to be off my feet for quite a long time after. There are other things that come into play with regard to, school drop-offs. Who's going to look after my 2-year-old? How's that? How am I going to I don't have family close by.
The treatment that I had to accept, I didn't have an option. As my surgeon pointed out, the pancreas is a nasty little organ. And as I've come to realise and understand it now, he's right. It's quite a dangerous little organ when you get a tumour or cancer, present in that organ. So I didn't have a choice in a treatment.
Well, the following day, I just went into let's go and sort out my life mode, wills, fix up all my finances. So I just went into that type of pattern. Toured the countryside for a bit of a so-called last look around. And I was sitting out at one of the local lakes, and the surgeon had rang again and said he'd spoken to his team a bit further and they were pretty confident of surgery, which gave me a little more hope and gave me a date to come down for a pre-op and book in for surgery.
And also I was allowed the opportunity to speak to the team over at Peter MacCallum. So my surgeon was brilliant in that respect, because the Peter MacCallum team had a completely different approach to what they suggested I do. So instead of going ahead with the Whipple surgery, they indicated that I undertake radiotherapy prior with no guarantee of having the surgery at the end of that period. I needed the time to step back and process that, which is why I said to my surgeon, well, no, I'm going to have my Christmas with the family. I'm going to take the time. And he was all for that. He's like, yep, not a problem. We don't have to rush into it. You take the time and make sure that it is definitely what you want to do.
I'll say crisis mode. I tried to keep it composed, but we had a business to consider. We had a major project on the go with a development with a new factory right next door. That came to a stop. All those things, I actually didn't consider too much about where I was heading. I was confident with where I was heading. I put that aside, knowing it was being dealt with well, with my daughter and particularly my wife doing all the things that were needed to gather information, prepare me for that. And I just focused on trying to organise my business and what was happening in my absence.
I was a public patient, and my surgeon just said he was going to book me straight into the Austin Hospital as a public patient. He said he put the surgery down as a Category 1 because I thought I'd be on a waiting list of some time, and I thought maybe the waiting period would far exceed my life expectancy. He said, but as a Category 1, there's not much that'll stop me. I'm booked in on that day and I'm going straight in.
So recording information is important, and Wendy does that very, very well. She's got folders, stickers, a Bible, so to speak, and quite often she's been asked, did she used to be a nurse? She's that inquiring about questions about blood tests and certain markers and this and that and one thing and another.
Extremely important in my case to have my husband there at every appointment. I found as I was being given information by my surgeon, I'm okay, but then I'd be processing that information. My surgeon's moved on to the next point and, sort of talking about, the next item on the agenda and, well, I'm still on item A, he's on B, and I'd be asking questions sort of 2 points back, whereas my husband would sort of gather everything and, be able to pause the conversation because he knew that I was not where they were at in terms of the conversation itself. Like we'd be driving home from a consultation and then I'd be like, I'd ask a question to my husband and he was like, bang, he'd remember everything and we'd go back and talk about stuff. So very important to have someone in an appointment with you.
He was a part of a bigger group of, believe there's about 8 doctors get together at the hospital each week, and they review all their cases. So there's surgeons, oncologists and many other. That was a great thing because he explained that in depth, that his decision is then criticised or supported by others. So that gives us confidence to move on with that particular surgeon and keep moving forward.
For anyone, regardless of whatever diagnosis you have, it is important to be able to just centre and focus and breathe and just, you owe it yourself to understand what is going, what has happened, the diagnosis that you have and what is going. So you need to think past the point of, okay, whatever treatment is to come. You need to be accepting of it.
Basically, I went in for what they called a Whipple procedure, which is a large abdominal surgery. Took somewhere between 10 to 11 hours. Recovery from that was slow.
In February 2015, I went in to have the Whipple surgery done. In terms of the recovery period, very slow, just with the surgery that I had undergone. I was learning to eat again, very, very fatigued, just a very, very slow process. So I was told that to allow, in terms of the recovery period, to allow a month for every hour under the knife. And to be completely honest, it pretty much took that long for me to get back to a point where I felt, sort of normal again after having the Whipple surgery.
My treatment post-surgery was chemotherapy. It was once a week for 6 months. Well, I was getting along like a rooster with my tail up, to be honest. I was back at work, made me a little nauseated, a bit fatigued, so I managed that. And I'm very fortunate my son-in-law works for me and so does my son, and so business was taken care of, so I could breeze in and breeze out. Just to step back a little bit, we were probably a little bit lacking information about side effects because I was going on a clinical trial and that didn't go ahead for a few reasons. So we went straight onto the chemo, and it all happened at the end when I was discluded from the clinical trial. My oncologist just said, okay, well, we'll get started with our regular program of chemo. And we found out much later that we'd actually missed an information session that they normally put you through because we just got a tiny bit lost in the system because of the clinical trial.
No, it was around this time that I was advised of the Pancreatic Foundation, who actually then helped my wife find some accommodation closer, and it was with their help that things started rolling along a bit that way to more help my wife than myself, and simple things like parking at the hospital at $30 a day, to get a voucher. It's just to stop that drain of funds. It was, you're not working, funds aren't coming in, you're still running a household, and just a little thing like parking, cheaper accommodation, less travel to and from the hospital. All those little things that help. But the Pancreatic Foundation helped a lot with that sort of stuff.
After my 6 months of chemotherapy, I did get a lung infection at Christmas time, so that sort of put me back a bit. So I missed the tail end of the chemo by a week or maybe 2 treatments. They didn't see that as significant. And then after Christmas in May, I believe it was, I was diagnosed with a return tumour on my pancreas. In this case, this is quite rare, so my pancreas and spleen had to come out. Very, very difficult operation and lengthy, and that was done successfully through his ability. That's now a diabetic because I have no pancreas, so that was a little hurdle to overcome, and I've done that. About 8 weeks later, I've actually had a re-diagnosis of 2 small tumours on my liver. So we can't surgically remove those. So I'm currently having chemotherapy to contain them or maybe even shrink them. In fact, yesterday I did get some good news that it appears that it's holding quite well. So we're happy about that.
So following the treatment, the relationship with my husband was quite strong. I think going back earlier to, I guess, the decision process and leading up to the surgery that I had, we talked through a lot of what was to come and what we could expect, especially in the time post-surgery. So for both of us, sort of verbalising that a lot earlier in the piece, getting to the point where, I was struggling and fatigued and, there were days where I just had nothing in me. There was already that understanding there that, okay, you just need that time and not to be rushed in anything.
Yeah, when I returned back to Ararat, my surgeon wanted me to stick with the one doctor. So with discussion with the local medical centre, I found a GP who was willing to take me on full-time and liaise with my surgeon here in Melbourne. So they were all on the same page with my treatments and how everything was going with that. So, yeah, it was good to walk in and see someone who knew exactly where I was in treatment.
I did see a psychologist. That was not something about having cancer or worrying about dying or anything like that. It was business, general life decisions making in my absence. It got on top of me. And so my daughter booked the psychologist. I wasn't going. I didn't consider I needed it, but I wasn't functioning. When I look back now, I just wasn't functioning. I went there kicking and screaming, so to speak, not in those real terms, but reluctant because I didn't consider I needed that. I was stronger than that. So I had 3 or 4 sessions, and to this day, that just helped immensely. It got me through. I did actually go to a doctor that my daughter organised with a little to deal with a bit of anxiety, and that was something that the psychologist was dealing with, obviously, but from a medical point of view. So I was just put on a small dose of a medication that I still take to this day, and it's not to be ashamed of. It's just helped no end.
Yeah, I went down to Melbourne in December and I got home early February. So I sat at home probably for another couple of weeks, exercise of about a 300-yard walk a day, which was quite a long way at that time, and just slowly built myself up. Just spent every day just going out to do a little bit more, a couple extra steps every day just to build myself up. Look, I don't think there was anything that I could have done that was different, but what would have helped is if there was someone to talk to that had been through it, to give me a guide as to where I've been or where I was about to go and what to expect, more so than the doctor's opinion of it.
Like, definitely live in the moment, take it as it comes. There are days where I just need to sit back and not do too much because that's what my body's telling me to do. But that being said, looking to the future as well. I feel with a young family that, there's a lot still to be done, still to be enjoyed, and, that gives me strength, and I know that it's just part of life, so just get on with it.
Yeah, don't give up hope. Keep a positive outlook. You never know what's around the corner. In my 6 years of having this problem, treatments have just come on so much more nowadays.
Plans now is just enjoying life, really. Not being hunkered down in sort of the negativity of what I've got. I think you can get lost in the diagnosis and, the mortality rates and the percentages of who lives and who doesn't. And that, for me, that's just, by the by. I'm unique, I'm me. I just need to get on with it. I have a young family and want to be with them for as long as I can. So,
keeping motivated and busy, if possible. And if they're not fortunate to have things to keep their mind occupied, find something. And, if it means asking other people to, go out for the day or find things that just get you through a day and maybe, or something to look forward to, I think that's probably the best advice I could say.